This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, with school back in session, plenty of kids are hitting the fields right here on Delmarva playing their favorite sports, and with those sports comes the risk of serious injury.
And one of those injuries is a torn ACL or anterior cruciate ligament. The Centers for Disease Control and Prevention reports there are 250,000 ACL injuries every year. That's a lot of injuries.
Yeah, and we always hear about professional athletes with ACL injuries like football players, RG3, Tom Brady. The fact is, though, anybody is at risk at any age.
In fact, some people are more at risk than others, and there's an easy way to find out if you're one of them. Soccer star Alex Short had to cut her season short when she tore her ACL.
I was just running on it and planted, and my knee buckled on me.
Young women like Alex are 4 to 10 times more likely to injure their ACLs than men.
Female athletes have weak hip flexors, weak hip abductors, and with that, their knees kind of cave in.
Girls like Alex who suffer an ACL injury before age 18 have a 17% chance of re-injury. Athletes are trained to rely more on their hamstring muscles than quadriceps to protect the knee. Try these 3 tests at home to see if you're at risk. First up, the double leg jump. Start in the squat position.
So they kind of sit their butt back, jump straight up and back down.
You want to be able to jump and stick into place without wobbling or having your feet or knees turn in. Next up, the single barrier hop.
They're going to jump up and over. Make sure their foot is sticking the landing the entire time.
Finally, try the hop, hop, stick.
If you see the knee kind of collapsing inward, that's going to be due to some hip weakness. So you want to make sure everything's correctly aligned.
If you're out of balance, work on your coordination, muscle strength, and core like Alex, who says her leg is getting stronger after surgery.
It's getting better and better every day.
An ACL tear or injury is not only very painful, but it can also lead to further problems with the knee in the future. So what can we do to prevent this injury in the first place? Well, joining us today to tell us is orthopedic surgeon Dr. Jason Skop, who is on staff at Peninsula Regional Medical Center and Peninsula Orthopedics. Thanks for joining us this afternoon. Okay, we just heard in that story that women are 4 to 10 times more likely to tear their ACL than men. Why is that?
That's correct. Female athletes, and actually females in general, tend to have stronger quadriceps than hamstrings, and so when they plant their foot, twist, turn abruptly, there's this net force that's translating the knee or moving the knee in a way that's actually starting to stretch the ACL a little bit. So in that little vignette you saw earlier, it really shows the rehab is actually trying to counteract those forces.
Okay, so what does an ACL do?
An ACL is a very important stabilizer in the knee, and I brought this knee model, which I will put the correct way, to show you exactly what the ACL's job is to do. It resists translation or motion in the knee. So when we're doing our sports, the knee obviously is going back and forth or flexing, extending. When we're running and cutting, the knee is actually going to start trying to move in different directions or rotate. So the ACL is the primary stabilizer that's trying to limit rotation and translation.
And where is the ACL?
Well, let's move the kneecap out of the way. Are you able to see this well?
Yeah.
The ACL is this main kind of ligament right in the middle of the knee.
Down the side.
A standing for anterior, or in our word, anterior means front. So it's the front ligament in the knee, or the main stabilizer.
And we actually have what a torn ACL looks like right there. If you see, what are we looking at?
Well, you're looking also just basically at a cartoon model of the knee showing when the ACL tears, unfortunately, it doesn't just make a nice little cut in it. It actually looks like an explosion happened in the knee. And so this ligament right here will just rip, and then the two ends, instead of being able to kind of suture them back together, the two ends just kind of migrate to different areas of the knee and sit there, and now once you have a torn ACL, you have a real loose and unstable knee.
Right. Now we talk about these high impact sports like football, soccer, basketball, but really anyone can suffer this injury.
Yeah, we always think that these are going to happen playing lacrosse, field hockey, any of the sports that we all do, but they can happen in everyday life. I've seen ACL tears occur in people getting off or on their boat, coming off a curb incorrectly, slipping on some water, so any of these things. But typically, our athletes are really at more risk because everything they're doing is involving cutting and stopping.
So then what you're saying is it's not just young athletes,
Nope.
but it can be kids, it can be older people?
Yeah, the sweet spot for ACL tears tends to start in the teens and end in the 30s and 40s.
Yeah.
However, I see ACL, just this week in the office, I saw a 12-year-old with an ACL tear.
Really?
And last week I saw a 66-year-old with an ACL tear. So really it runs the gamut. But if you think about it, our younger kids and our mature athletes everyone's active these days, and so everyone's at kind of a risk exposure, and it can happen to anyone. It even happened to me.
So, Dr. Scott, what are some indicators that you might have a torn ACL?
Well, it's going to be a bad day. So if we're looking at that, you're going to hear a loud pop in the knee.
Right.
That's usually the first question I'll ask a patient in the office when when you were doing this, did you feel or hear a loud pop? And sometimes they'll say, I felt 1 or 2 pops in the knee. The second is pain. Obviously, a knee injury is going to hurt. And when you get this loud pop, it's going to hurt, and that's your body telling you to stop. Unfortunately, not everyone stops, and sometimes they will continue to play until the third thing, which is swelling in the knee. And one of the main things that I'll see if someone got injured yesterday in the office and they come in with a big swollen knee, then we know that pretty much that they tore an ACL. And then the last thing is the knee feels loose. And I always recall an injury that happened when we were covering the Salisbury University Division III championships in Baltimore several years ago. One of the players during one of the opening plays had a twisting injury to his knee, and I ran out to the field in front of 35,000 people, and he's laying there, and he had not had swelling in the knee, he had none of that stuff, and I basically watched from the injury until 30 seconds later, just this massive knee explode, and I said, buddy, I hate to tell you, but you just tore your ACL, and he had a pop, swelling, pain, and looseness. So all 4 things that we just reviewed instantly happened within about 30 seconds.
Now, you said you've had a torn ACL.
Yes.
So with this player you just talked about, what kind of long-term thing can this lead to?
Well, whenever I talk to patients about knee injuries, I always say, well, what's the natural history? What would happen if we left the ACL or the knee without an ACL? And what would happen, unfortunately, we'll go back to the model if you like, is we're going to have looseness in the knee. And when you have looseness in the knee with all your activities, you can think you're going to have rubbing and you're going to have kind of irregular forces, and over time can lead to arthritis, can lead to damage to the other structures in the knee. And so we recommend ACL reconstruction. What that does is basically restores the knee back to its normal state, or as close to normal as we can get it, to minimize the risk of secondary damage to the knee.
Is there anything we can do to prevent it in the first place?
That's a great question. The ACL prevention programs have really come in vogue recently, and that little vignette that we saw at the beginning of the program demonstrates that we now understand these deficits that happen in athletes, and so if we correct those deficits then before the injury happens, then we can do what's called an ACL prevention program. And so when someone sees me in the office, even if a 12-year-old girl comes in with a stress fracture, I always evaluate them with some of those tests that we saw on that video, where I'll do some hopping in the office, I make them do a little bit of a workout, some jumping, and I look for that knee collapsing. And when that happens, I actually put them in a therapy program that's involving these ACL prevention programs. So when they're jumping and landing with the knees bent, I'm looking at those things. It's so vital to warm up before exercising, and if you try to exercise without your muscles warmed up, all those deficits are actually accentuated or kind of exploited and made worse. And nobody likes to warm up.
Right.
I don't like to warm up.
You would just get to it.
We just want to get to it. And finally, it's paying attention to the proper form and seeing those deficits, having a therapist or your athletic trainer or your coach say, all right, I'm worried about these couple players, and I'm going to watch the way they run, especially preseason right now. We are on high alert for all these patients. So when they come into my office and we see, you might come in for a shoulder injury, but I check. I say, all right, you're a field hockey player. Let me do this test real quick.
Right.
I watch their knee collapse in like we saw in that video, and I say, you know what? You need to do some therapy so you don't tear your ACL 3 weeks from now.
Now, it's something that they hate to hear. Athletes hate to hear that they tore their ACL, but it's not career ending. It's just season ending, right?
Exactly. Exactly. The surgical reconstruction of the knee is very reproducible. In fact, there are, as the video said, 250,000 ACL tears in a year. The surgery now is done as an outpatient, takes under an hour, and we have very strict return to play protocols, and it involves the surgery, it follows close follow-up with us in the office, and then physical therapy, and then we even, before we release an athlete back to their sport, we put them through basically the ringer. We put them through this return to play protocol, and if they don't meet certain guidelines that are actually numbers, if their quads, their hamstrings are not where they need to be, well, they're doing another month of therapy.
So 6 to 9 months recovery.
Yeah.
And we'll get you back in.
Yeah.
All right, thank you so
Dr.
much.
Nice to meet you.
Dr.
Great
Scott.
information. Hang on here just a second.
To learn more about what we discussed today, including more information on how you can help prevent the injury, go to delmarvalife.com and click on the show tab. Still ahead on Delmarva Life, packing school lunches is now a daily routine for many parents, and the same old sandwich can get boring day after day. We're in the kitchen next with a few ideas to keep it cool.
And a little later on, an option that many dog owners are embracing is an alternative to a physical fence is an electronic dog fence system. In today's Angie List report, we're going to find out what you need to keep in mind before you get one installed and flip that switch. But first, moments ago, we learned about reducing your risk for ACL injuries. Dr. Oz tells us how we can also lessen wear and tear on our joints.
Osteoarthritis is a degenerative disease where the cushiony cartilage surrounding the joints wears away, typically in the knees and hips. The pain can keep you from doing many of the things that you love. The risk increases with age, but it's not inevitable because lots of older folks have perfectly healthy joints. Here's how you can preserve mobility. If you can lose 10 pounds, you can decrease the risk of developing osteo of the knee by a half. Do exercises to strengthen muscles that support joints, including range of motion and stretching exercises to keep the joints flexible in all directions. Correct bad body posture and improve your balance. Tai Chi and yoga are great for that. Take a load off misaligned joints with orthotics or splints. Don't wait until things hurt. Start young.